Hello, I'm Jessica Brees. I'm a certified nurse midwife with the Center for Midwifery at the University of Colorado Hospital. Today I am talking to you about the second stage of labor and pushing with an epidural. After a woman is completely dilated and is 10 centimeters, there's often a resting phase where the body is gearing up and preparing to birth. So there is sort of a pause between the first and the second stage frequently, naturally, as well as with an epidural. And then the second stage of labor begins with pushing. Right now I'm going to show you how a woman with an epidural can utilize a squat bar while pushing. It does require some testing out her legs first. Some women feel that they've got great motor function and the ability to move their legs around, but once they're actually standing up on their feet, you have to feel it out and make sure that it is a comfortable and safe position for you. Therefore, none of these positions should be done alone. You should always have the assistance of a minimum of 2 people. Once you start feeling a contraction beginning, or if your support people can identify on the fetal monitor that a contraction is beginning, you'll want to get in your position of squatting. You'll want to start to scoot forward, and you're going to use the strength of your own body, either your forearms, your hands, and you're going to lift up and hang. And you're basically going to hang off the bar into a squat position. Most importantly, you want to make sure that you're using your feet for support. Women will need assistance into this position, and then after the contraction, they'll need assistance out of this position. You do not want to stay in this position for too long because you can cut off the circulation to your feet. Another way to utilize the squat bar is a place to put your feet down when you are in more of a reclining position. Women with epidurals sometimes don't have a lot of control of their legs, and they don't have as much stability in their hip joints. So their legs sometimes can flop out. It's always a good idea to put a support person on either side of their legs to make sure that the legs don't fall out too far and cause any nerve damage. Another way to utilize the squat bar with an epidural with pushing is using the method of the push-pull. You can tie a sheet around the squat bar, make a knot at the end of it, and a woman can use the traction of her own body. This is the push-pull, and you can actually utilize your own body and the traction that exists between your feet pushing on the bar and your arms pulling. It's a good idea to utilize your elbow and curl your back around your body. It's always great when you're with or without an epidural to change positions with pushing. One position that women enjoy when they have an epidural is pushing on their side. The way that you do that is you roll over onto your side, and then you can have someone support your upper leg while pushing. Your job as a support person is mainly just to assist the woman to maintain this hold so they don't have to utilize unnecessary energy. You'd think that you can help her push her baby out by flexing her legs. Because she has less sensation due to the epidural, she's not going to feel if you're damaging any aspect of her upper leg and hip joint. Hands and knees is a wonderful position even with an epidural. So while you're changing into different positions, you have to be very conscious of how you feel, how strong your legs feel, and the support people around you and their ability to get you into these various positions safely. So when you're getting to hands and knees position with an epidural, it is a good idea to have the back of the bed slightly elevated. And that way a woman can get a little more traction and use the bed for support as they are rolling onto their hands and knees. So again, you want to See how much of the position change a woman can actually do on her own. That also prevents injury for the woman as well as the support person. Onto your knees gently. Sometimes they need help with that lower leg. And then they're going to sort of walk their way up to the head of the bed. Very important that the knees stay wide in the pelvis for your baby to rotate through. And they can either utilize the weight on their hands, or they like to use their forearms. Sometimes they prefer to have the back of the bed up really high. This is still considered a hands and knees position. This is a nice one to be able to rest in between contractions.